So postpartum, some things I'm going to be talking about are effects of childbirth. So we'll be going over vaginal birth, C-section, and a VBAC. We'll talk about a little bit about early recovery following delivery for both, as well as some common signs and symptoms you'll see following delivery. So first off, pelvic floor anatomy, really quick, just like what Q talked about. The bottom of the pelvic floor has 3 different layers of muscle, and I tell people to think about each layer has their own jobs per se, but they all work together for bowel and bladder function, keeps everything up and in while we're sitting here and listening to this presentation, lets everything out when you're ready, whether you are at home in the restroom or in the woods, whatever of your liking. And then it helps with sexual activity as well as labor and delivery. So looking at how it kind of closes all of these sphincters for your anus, the vaginal canal, as well as the urethra, that's going to play a really big role following postpartum. So let's talk about vaginal birth. So effects of vaginal birth, there may be certain things that, this is not an all-inclusive list, just kind of major things that we see in the clinic. Perineal tears are very common. It is the space between the back of the vaginal canal as well as the anus. So if you look at the diagram to your right, there's 4 different degrees of it, and each degree is essentially named for how far the tearing has happened. First being just skin, 4th being a complete tear from vaginal to anus through the sphincter and into the rectal lining sometimes. If you look at the second little line, it says episiotomy. So currently speaking, episiotomies aren't very commonly done anymore. There's been a lot of research saying natural tears have a less likelihood of increasing the amount of tearing. So there is that, but it is dependent upon your OBGYN. So it's something to talk to your healthcare providers about. And on there, you'll see something called pelvic organ prolapse. We'll talk about that, I think, in the second or I think 3rd week. Essentially, in a quick snippet, it is just people will talk about feeling some sort of heaviness from the vaginal canal or a balloon or something protruding. It is essentially the pelvic contents, whether it is your bladder, your uterus, your rectum, kind of pushing forward into the vaginal canal, secondary to increased pushing time and all of those things. Tailbone pain. Tailbone pain is very big during pregnancy, as well as following for vaginal birth sometimes because of the amount of pressure and pushing. For the clinic, we usually will have at 36 to 38 weeks, we'll do something called labor and delivery positions. So we will actually set a woman up and check her pelvic floor as to what positions they're more comfortable in. Essentially speaking, that you want to make sure pelvic floor is actually relaxed when you are in the pushing phase of labor and delivery. Okay, so then diastasis recti, in short, people call it a DRA. It's where you see a little bit of abdominal splitting because the belly has no more room for baby, and body has to make a decision whether it's aesthetically pleasing or baby growing, and generally speaking, it is going to be baby. Baby always wins. You'll see a little bit of bowel and bladder dysfunction just because of the increased stretch of baby's head when they crown, as well as shoulders when they come through the vaginal canal. So there is that. Something to also think about too is pain with sex. It could be secondary to vaginal soreness from delivery, or any scarring or from the episiotomy, or any tearing. So this was a really neat little visual for cesarean sections. So I'm going to move on to C-sections. So we always talk about C-sections being kind of normal or whatever it is, but this is just a really good animation as to how many layers they actually cut through. So you'll see skin, fat, fascia, which is like tough fibrous lining. That's your abdominal wall, and you'll see the linings cut up and down. Peritoneum, which holds the organ and cavities, and then you'll see your uterus and your bladder. They'll remove the bladder back, cut through the uterus, there's the sac, and there's your baby. So looking through all of that, it's about 7 layers of tissue that is cut through in order for us to get to baby. So something to think about for C-sections. Now, postpartum effects of C-section. So risk of infection, just because it is a surgical procedure, there is a high risk for healing, how the incision does. There is scar tissue and adhesions that we have to think about, because looking at that 7 layers, they have to sew back down those layers. So looking at how the body kind of scars down to protect itself. Some women may talk about abdominal pain, sensitivity, some numbness or tingling in that region. Again, the diastasis recti is really big just because of the lack of abdominal strength when baby is growing and abdominals are so far from the body. Now, looking at lower back pain, there is risk of bowel and bladder dysfunction, as you can see, because when they have to make that incision all the way down through the peritoneum, they have to move the bladder back a little bit. There is a chance that if it is your first, second, or third cesarean section with scar tissue, there may be some adverse effects to that. So let's talk about early recovery. So baby is here. Some things to think about for moms: wound care. If you had a vaginal birth, oh, I'm sorry, VBAC. For some reason, I guess the screen cut out. So VBAC is a vaginal birth following a cesarean section. It is possible if it is, there are different criteria depending on the hospital as well as your OBGYN. So a conversation to have if you had a C-section for the first or second child and you want to try a vaginal delivery. The pros of it is that it's a shorter recovery time because you don't have to go through another surgical procedure. The risk of surgical complications are much lower. However, there are things to look at in the sense of, again, scarring. How much scarring there were are there any complications with umbilical uterine rupture and placental rupture? So again, conversations to have. Early recovery, sorry. So then vaginal birth, we want to take care of the perineal tears. So making sure we keep everything nice and clean, nice and dry. Generally, you can come home with those little squeezy bottles that have a little hook tip to clean the area to make it a little bit more comfortable. Making sure C-section scars are, again, clean, dry, and you're changing dressings. Then you have to think about posture and mobility. Following delivery, everything's a little more painful than usual and a little bit more sore. So like Hugh said, postural awareness. We went from super pregnant, super kind of in whatever position pregnancy is, to now no belly, and all of a sudden breasts are engorged because you're breastfeeding, and now you're feeding a lot, which puts us in this really curled and hunchback position. So understanding how to open up through there and getting, like Hugh said, some better support for the breasts, as well as looking at bed mobility. So that's a really big one. Baby cries, we're tired, but making sure you're not getting up like a sit-up. You want to make sure you roll to protect your incision, whether it is abdominal or vaginal. Transfers are things like sitting to standing from a chair, getting in and out of a car. Again, those are things that we go over in clinic in the sense of how to protect your wounds and how to protect your back and your abdominals to make sure that you are transferring successfully with decreased pain. Lifting and lowering, we do this a lot following delivery because there is a child now. So understanding mechanics and how to lift and lower from the hips or the knees using your abdominals and the TA that Q was talking about to make sure we're protecting our spine as well as our pelvic floor. Support and strengthening. So the abdominal binders for pregnancy are a little bit different than the ones following delivery. There are some that you can buy that I think will make for both. The big one that we don't know the name of that was in the top left corner when Q showed us, I'm sure I can pull up a picture later if someone's curious. It goes right around the abdominal region. It just acts like a good corset and it gives that abdominal region just this big hug. So we feel a little bit more supported in the early stages of recovery. So strengthening of pelvic floor and core strengthening. So in the next slide, we'll talk about common symptoms, but pelvic floor, looking at the Kegels, do you need to do them because they're a little bit weak, or is it now overactive because it went through something a little bit more traumatic? So some things that we look at as well. Core strengthening to make sure low back and everything is nice and taken care of. Lastly is functional mobility. We're all very big with this in the clinic just because, again, lifting and lowering is very big following delivery because the amount of times we feed the baby and the amount of times we have to change baby, skin to skin, and nursing and all of those things. So we'll go over mobility there, and then breastfeeding techniques. So a lot of the times the mommy thumb actually comes in maybe later down the line when baby is heavier and we're lifting them this way. However, I just actually spoke to a patient who was feeding with her hand under the head, and then she was always turning the baby's head toward her breast because baby wasn't latching the way she wanted to, and then she developed the mommy thumb. So again, some things to think about mechanically when we are nursing, and we'll talk about positions to nurse that is easier for mom as well as more productive for baby. Let's see. Okay, so last one, common symptoms. So these are just kind of a running list. Again, not all inclusive, but common symptoms we see following delivery, whether it is vaginal birth, C-section, or a VBAC. Urinary and fecal incontinence, a little bit of leakage, which we'll talk about, I think, next week. I think next week's bowel and bladder, so tune in for that. Overactive bladder, like Hugh said, where the brain just kind of goes, oh, I need to go now, I need to go now, I need to go now, versus knowing that the bladder can hold anywhere from 2 to 4 hours. And then constipation is really big following delivery, just because of medication, if you got an epidural or there are pain meds or whatever kind of is happening. There's a lot of hormone changes happening. Hemorrhoids are one of those things that we see as well because of pushing. So that's something we will talk about, how to lengthen pelvic floor so we don't increase any hemorrhoids when you have a bowel movement after baby is here. Vaginal heaviness, we'll talk about the pelvic organ prolapse, but that's one of those symptoms that a lot of women will come in with, saying they feel like something's falling out of the vaginal canal, where it's just a lot of the pelvic organs pushing through the vaginal region. Vaginal dryness, some women will experience due to, again, the major hormone changes. There are some things you can talk to your OB about to kind of help with that. Perineal pain because of either tearing or soreness from pushing and from having baby come through the vaginal canal. Scarring is a really big one, whether it is a vaginal birth or a C-section. So making sure the scar is moving the way we want it to, and it's not super rigid or keloid, because that will lead to other issues such as adhesions or pain. There will be some numbness and tingling just because they do have to cut their nerves anytime we have any tearing or cutting through of any tissue. And then we'll talk about a little bit about pain with intercourse is one of those symptoms as well. And it usually will subside, but sometimes because there is scar tissue at the perineal region, that is what causes the sensitivity and the pain. Lower back pain, abdominal pain and sensitivity. Abdominal weakness is a really big one just because we were pregnant for 40 weeks. So then looking at hernias, umbilical hernias, inguinal hernias, those are also very common sometimes when it comes to where we were strength-wise prior to delivery, as well as prior to pregnancy. And then looking at the bending and lifting, which is a really big part of postpartum care. Hypersensitivity to the skin. We also look at clogged ducts. So people talk about mastitis and making sure you're feeding on both breasts. So those are things we talk about, as well as swelling. So compression garments will be really good for the weeks following delivery, just to kind of keep everything held in and moving. So next we have pediatrics.